everyone. My name is Sophie Morioki. I'm a clinical psychologist based here in Nairobi. And I am in private practice at Psychosocial Support Services. So I think for me it's an honor and a privilege every time I am able to talk to my fellow colleagues and just to have a chance to have conversations in matters around mental health. In my private practice, I tend to have these conversations a lot, not just in terms of one-on-one therapy or group therapy, whatever the case may be. And I always take it as a point of just honor and privilege. And so thank you for joining us. And I hope that whatever we discuss today will be of benefit to you. So I'm based, like I said, in Nairobi. I tend to see people with a range of issues, adjustment issues, depression, anxiety, all the more clinical cases as well. And this is in terms of individuals, but I also tend to see couples, and in some special occasions, children as well. And for me, it has worked out in such a way that when you see children, you cannot just be with the child on their own. When you're sitting with them, it's okay in the therapy room, but when they go home, you realize that they also have people at home that they deal with. So then it becomes a holistic approach in terms of what I hope to achieve in my work and in private practice. So today's conversation will be around women and mental health. And even as we jump in, it will become apparent as to why women and mental health. But I want us to consider an example of a situation that is not unique to this particular lady called Amina. It's probably something that we've seen around with many people. Maybe you've seen it among other colleagues or with family members or friends. So let's look at Amina. So this is a 37-year-old lady, a wife and a mother of 3. But she was raised in a single-parent family. Amina was the third born of 5 children. So they were okay in terms of upbringing and things like that. So they came up in in terms of middle socioeconomic status. So in other words, the mom was able to put food on the table and feed the family. But of course, with families that have a number of children, like hers did, the older kids had to help take care of the younger kids. So Amina grew up okay, and when she was about 14 years old, her uncle made sexual advances towards her and told her that it was their own little secret, and that if she said anything to anyone, including her mother, it would make her mom feel bad. And so she never spoke, she never said anything to anybody. She suffered through that experience and lived with that experience. So Amina goes on and finishes primary school and goes on to high school, where she did quite well. And she realized that she had a passion for helping people, and she wanted actually to go into the health sector. And so she did her due diligence and did well in high school, and she managed to get into med school. And through different financial avenues, she was able to go through med school and complete it. These are things that we might take for granted for some people, but for others, they struggle. But while she was studying, she had several relationships, and during one particular stint, she got pregnant. But her boyfriend could not wrap his head around it, or whatever the case may be, he was not interested, and so she felt that she was forced to terminate the pregnancy. Because in her mind, she didn't want her career to end before it had begun. And she did not also want to bring what she felt may have been a burden back home. So she terminated the pregnancy. She was haunted by the decision for years to come and by the loss, but again, she pushed on. Eventually, once she finished high school, med school, she was employed at a local private hospital. She met a guy, a businessman, and they forged a relationship, and further down the line, they got married. But see, we have expectations, and society has expectations of us that, you follow a certain path. You you're born, you grow up, you go to school, and so on and so forth, you get married and you have children. So she's married, and 5 years down the line, they don't have any babies running around. So this becomes a strain on their relationship and on her psyche as well. And she starts now feeling and thinking about her life, where she's come from, where she's heading. She realizes that she's having, ghosts of the terminated pregnancy, of the sexual advances made by her uncle, things that accumulated over her life. Infertility issues, these are not things that were ever talked about to her. And she just started feeling like she's cracking at the seams. So we'll be able to talk about Amina more a bit later. But just to highlight some of the things that she may have been experiencing included sleep difficulty, loneliness, a sense of worthlessness, and to cope with the stress that she was experiencing, occasionally she'd use substances in terms of alcohol or even other drugs. I mean, she had access to drugs at work. At home, she had a frustrated husband. It was increasingly volatile in that relationship, and even had episodes of intimate partner violence. She did come from a supportive family, but they did not know what she was going through. Would we say this is a dire situation or a dire picture? We shall be able to unpack as we go along. So I'd like you to maybe take a minute and think about you as a woman. And I guess you're a woman first, but then what else are you? Other than the specified gender, what else are you in terms of roles, expectations? What do you feel like you're juggling? What do you feel like you're experiencing? What do you feel like is expected of you by colleagues, family, society, your community, whatever the case may be? Just consider that for a moment and try and put yourself, in that position where you're able to say, this is who I am, these are my roles, these are the expectations. Who are you as a woman? Why we want to talk about women and mental health in honor of, the International Women's Day that we had a couple of weeks ago. In this month of March, we're focusing on women and their mental health. We were invited to choose to challenge this year. And so this is why we thought this would be a good way to continue honoring women and indeed continue honoring our healthcare workers, because then the challenges being experienced are quite a number, and it's always good to just keep supporting one another even in this difficult season. So in terms of mental health, there's different ways to look at it, but it's important to recognize that there's a difference in the manner with which men and women have the ability to determine even their social standing or their place within society, their place within their community, their status, and treatment as far as mental health issues are concerned. And this is something that has been investigated and highlighted by the World Health Organization. And their findings are that women tend to be more susceptible to mental health risks. It's also good to highlight and say that the differences or variations that are attributed to an individual are more than their reproductive organs. So when I talk about women, we're not just talking about the assigned gender or the perceived gender, whatever the case may be. And we'll be able to talk about that again as we go along. It's also good to say that when we talk about psychological issues, we find that there are some disorders which are highlighted or presented or manifested differently. Like for instance, in more clinical cases like schizophrenia and bipolar, certain symptoms in some psychological issues are more common in men than in women, and they're more common in women than in men, and so on and so forth. And the way that cause of distress travels or the cause of illness goes on can also be affected by the gender of an individual. So when we talk about gender differences, it's more than just as a result of your biological sex. Your own self-representation is taken into consideration in terms of psychologically speaking, behaviorally speaking, social consequences even of how one perceives their gender to be. And so this is also the case with psychological issues. And the understanding is that one's gender can actually influence illness in terms of psychological disorders are concerned. So we then want to look at one. Is it that one is more at risk for a disorder because of their gender? So there are some psychological disorders that are gender specific, if I may call it that. For instance, premenstrual dysphoric disorder. So this is a psychological disorder that is specific to women because it's attached to their menstrual cycle. The other thing we want to look at is prevalence rates or incidence rates for mental disorders. Some of them show increased gender differences. Thirdly, gender can also influence the likelihood that particular symptoms of a disorder are experienced by a certain individual. For example, cases of bulimia are seen more in women more than in men. And of course, finally, one's reproductive life cycle can also influence a particular illness. So with women, maybe it's based on where they are in their menstrual cycle or reproductive cycle in terms of having just had a baby, where other factors come into play other than just their gender, you know, the surge of hormones and things like that. So if someone has just delivered a baby, then are they at risk for postpartum depression and things like that? Having said that, in all the disorders that we see in matters mental health, we always look at gender-related issues. There are things that you have to consider in each disorder. So even if you're saying that there are some disorders that are either unique to women or more prevalent in women, it doesn't mean that men don't get affected by some disorders. So if, for example, if we say issues to do with depression and anxiety are seen in women more than in men, it doesn't mean that we don't consider how these things affect men. What this discussion is not about, as in what we want to also highlight what it's not in terms of women's mental health. So we find and this is maybe a conversation that has happened for eons before us in terms of feminism and things like that. But what it's not just about how a woman's well-being is linked to her children or her family, and ultimately society, which is what research is showing, that we have to take more into account other than just a woman's offspring and their family and where they come from. There's been a clarion call, you could say, for definitions of women's health, which are broader than the reproductive or the maternal aspect of it. There's a call to incorporate maybe the mental and physical health of a woman across the lifespan. Yeah. And this is something that has been repeatedly expressed in recent years. Even feminist theories have recently argued that a woman's well-being is not just solely determined by biological factors and reproduction, but you also have to take into account their workload, their nutrition, stresses, migration, war, everything that we see under the sun, so to speak. We have to incorporate all that when you're talking about women's wellness. So even understanding that the source of ill health for women means understanding how maybe economic factors come into play, cultural factors come into play, how all these interact to undermine their social status is important to bear in mind. Social networks can also represent additional stress for maybe women who are more disenfranchised or in lower socioeconomic status. It's important to even just be able to reflect on that, even as we have this conversation. So we've said before that mental disorders or mental health issues can affect women and men differently. And so studies have shown, years and years of studies have shown that some disorders present more commonly in women. For instance, psychosomatic concerns. So this is where you're experiencing a lot of psychological distress and it comes out physically speaking. So maybe you find that based on the stress you're under, you feel maybe your shoulders are sore or tense or tight. You have breathing difficulties, chest pain, back pain, headaches. You know, it's in the physical. But organically speaking, there's nothing wrong. You've done all the tests and everything, there's nothing wrong. And so maybe you've been told it could be something psychological that's happening for you. So issues like that, depression, anxiety, tend to present more in women. And even according to WHO, 1 in 3 women are affected by these issues. Again, certain types of disorders are unique to women. So for instance, issues like perinatal depression, premenstrual dysphoric disorder, menopausal related depressions. These are things that are unique to women, and they occur at times of hormonal changes. Certain population groups may be more vulnerable to mental disorders, and so it's always good to be able to target and create interventions that are specific to some of these groups. So for instance, women are considered as a special population. Even research done here in Kenya, and this has been attributed to their vulnerability to factors such as sexual and domestic violence, poverty, discrimination, and conflicts, which exposes them to, that increased prevalence of certain mental disorders. And according to WHO, the traditional role of women in societies express them to greater stresses. Yeah, so having that traditional expectation, carrying that on your shoulder, we're being told that alone exposes you to greater sense of stress, which makes them less able to change their environment maybe, and so continued exposure to that stress continues to increase their vulnerability to developing a mental health disorder. So research even here in Kenya has been done in order to look at or to contribute to the conversation as far as postpartum depression is concerned. And a study that was a first of its kind in Kenya, done in 2016, wanted to actually look and see whether postpartum depression starts manifesting before one delivers a baby. And they were able to investigate this among a cohort of pregnant women that were residing in a poor setting in Nairobi. And the reason for this was because there seems to be growing evidence that was pointing towards a multitude of effects that were related to what they called antepartum depression. So even just being able to see that a lot more research is being done across mental health issues with women is not only comforting, but also shows that there's a need. There's a need to understand this subject a bit better. So they were able to find that risk factors associated with postnatal depression included things like current or past emotional, physical, sexual abuse by a partner, discord within the marriage or within their relationship, lack of financial support, lack of social support, unwanted pregnancies, stressful life events during a pregnancy, past psychiatric issues, poor antenatal care. All these factors seem to contribute to the likelihood of postpartum depression coming, and in fact, antenatal or antepartum depression occurring within these pregnant women. In the same study, they were able to reflect and say that worldwide, about 10% of pregnant women and 13% of women who had just given birth experience some sort of mental health issue. Primarily, this would be depression. And we're finding that in developing countries, this is even higher. This is even higher. So it just shows the need for going beyond conversation and being able to find out what's happening in our society and in our communities. It has even been implied that maternal mental health or maternal mental health disorders negatively affect the growth and development of one's children. So you see, in other words, this is telling us that experiencing some of these things as women not only affects the individual, but even their children. And so then this is something that gets passed along, and it's a burden that's borne by just the client themselves. So even as you continue looking at these issues that are unique to women, one's socioeconomic status is important to consider, because then approximately 20% of women suffer from mental disorders within the first year of giving birth. Yeah. Stress, again, their status, intimate partner violence, lack of social support. Some of these are predictors even to show that someone might have an issue with, or they might struggle with postpartum depression. When we look at the role of women within our community, you find women tend to be caregivers, carers, isn't it? So even as in your role as a healthcare worker, beyond the role you have at work, at home you could be a caregiver as well. And so when you find that that is the kind of weight women are carrying, then it's not surprising to find that there's increased mental health distress among women. Because then women serve as community health workers, they're nurses, they're midwives, they're caregivers at home. And so they're more likely to experience psychological distress just from that burden of providing care. A scenario was highlighted by a Kenyan hotline, the hotline 1195. They were able to do some, look at their statistics and find that within the COVID season, particularly last year, they had an increase in reports that violations against women had taken place more within the last year than they had seen previously. So they had an increase in reported cases, both men and women, but they did have an increased number of violations against women. They were also able to share that they had an increase in the number of completed suicides and indeed murders. So then that just shows that the stress that we experienced and are continuing to experience manifests just outside of the body and even impacts on how we relate to one another. We've talked a lot about the impact of some of these mental health issues in women who are pregnant and in women who have had babies. And a lot of people are aware of postpartum depression, which tends to occur around the first year after giving birth. But then it's less well known that women can experience it before giving birth, that you can actually start seeing these signs prior to one's delivery. So it's important that we bear that in mind. Even as you're serving your community, as you're looking at your families and friends, it's important to just remember some of these things that maybe fall through the cracks. There's one researcher who found high levels of reported stress among single mothers in Korogosho, yeah? And this was coupled with high levels of emotional support. But then there was also very low levels of financial support, as you'd imagine in an informal settlement like that. And so their experience was that a bulk of the emotional support women had came from other women. And this is expected. Women tend to hold hands and pull each other up and things like that when they're down. So this suggests that maybe relationships, if some of these women had the kind of emotional support from men that they did get from women, then maybe this would help them, pull them up and help them go through a tough time in a better way. And especially under special circumstances. So for this particular author, they felt that the time has come to pay attention to mental health, or particular attention, and therefore also expand the scope of research beyond just an individual and just, take it across disciplinaries, or take a multidimensional approach to understanding what is behind poor, what is actually driving the poor mental health status we're seeing among women, and to consider that women's roles as mothers and partners have to be part of that equation. So you look at the woman as an individual, and then you look at the other things that contribute to her as an individual. So be it her work, her family, and so on and so forth. So then, are there things that put us at risk as women into developing mental health disorders? So sometimes you'd imagine one's socioeconomic status puts a woman at greater risk, and it is indeed the case that it puts women at greater risk of poor mental health than men. Other considerations that we should take into account is that our women tend to be more likely the carer for their children than men. They tend to more likely be the carer for the elderly or the disabled or anyone else or differently abled. Women carers are even more likely to experience anxiety and depression than other women. So we're saying not only is depression being seen more in women than men, it's being seen more in carer women. So whatever role you have, and in this case, as a healthcare worker, it's a risk factor, to put it bluntly. But a risk factor is not a definite diagnosis. It just tells you maybe you need to take into account what you are carrying and be aware of how that might have an impact on you. Another risk factor is the fact that women are more likely to live in poverty than men. And this is probably contributed by the fact that there's more restriction or greater restrictions to access to social support such as education, and sometimes even our cultural practices hinder girls from going to school. And so this poses them at a greater risk of living in poverty, and therefore it's a risk factor for mental health issues further down the line. So sometimes even just the fact that in terms of one's socioeconomic status and poverty, and working mainly in the home, one's concern about personal safety can actually make a woman feel isolated. Yeah, so maybe they're concentrating on the work they're doing at home and not able to walk around or interact with other people within their community. And this isolation is also linked to mental health issues. Physical and sexual abuse can have a long-term impact on women's health, especially if they haven't received any support. So if we look at cases of intimate partner violence, women tend to stay silent for a very long time and endure the pain and endure the violations. So then they don't receive the support that they need, which in turn contributes to mental health issues. And women are exposed to more sexual violence than men. So that means you're going to see more issues of trauma in women than you will do in men. So if you even just bring it down, or more specifically into healthcare workers, and particularly female health workers, there are other risk factors that contribute: gender inequalities, biases, the gender power relations. And when you look at what lies beneath, it could seem a bit heavy to carry. Yeah, you're looking at the poor resources available, the precarious work environment, the low or unequal pay, unpaid labor in some cases, lack of recognition. You do all the work and you just don't feel like you're seen or validated or appreciated. A lack of space and opportunity, gender decision making, so decisions that seem to be made biased towards one gender than the other, and even just the gaps one can identify within their either roles or community at large. These tend to contribute towards increased mental health disturbances. On the other hand, let me just contribute a bit more about the risk factors. There are things that maybe we need to highlight. For example, having adverse childhood experiences. Remember the case of Amina. She had an experience as a young girl and never spoke about it. So sometimes when you have repeated traumas, they compound, and somewhere along the line one can develop a disorder like PTSD. But then having adverse childhood experiences poses an increased risk of presenting with psychological distress later in life. And sometimes women find it hard to talk about difficult feelings and even internalize them. And then this contributes and leads to things like depression or eating disorders. And sometimes we express our pain through self-harming. If you feel you're not able to talk about what you're going through, you could easily be self-harming. Self-harming includes things like cutting. They're not deliberate attempts to end one's life, but there are attempts to injure oneself in a bid to release some emotions or some pent-up emotions that one is experiencing. And sometimes even when you look at the other end of the spectrum, older people tend to face more difficult life events and daily stresses. And then you find people who are more senior in years are experiencing other mental health issues, when in fact they should be enjoying their sunset years. So maybe they're feeling that they've not accomplished what they wanted in life. You're maybe going towards retirement as a healthcare worker and wondering, what have I done? Did I achieve what I wanted with my family? Did I do this? Did I do that? I want to be able to enjoy my retirement, but then it's, I'm coming away with meager earnings, things like that. Those can also contribute and put one at greater risk. Having said that, on the other hand, we do have protective factors. Women tend to have better social networks than men, and therefore sometimes find it easier to confide in their friends. And they generally find it easier to talk about their feelings, and they have strong social networks. So sometimes we have the strong social networks, but we don't talk. But having those networks are also very important in helping us with our mental health. And women are more likely to be treated for a mental health problem, which is a reflection on their willingness to acknowledge that they need help. Their willingness to be vulnerable enough to say, hey, I'm struggling, work is just getting to me, and I need the help. So protective factors are also very good to consider. So what do we need to look out for? Even as you're juggling all these things, are you having a sense of worthlessness, hopelessness? Are you using drugs and alcohol to just feel better? Decreased energy or feeling fatigued, excessive worries, fears? Do you find that you're withdrawing socially? So you're able to put your hours at work, but then you're not able to socialize. And of course, suicidal thoughts. Those are things that we always need to look out for. So if you're experiencing any of these things and you feel maybe Aminas story touched you somewhere, again, we said this is not unique. It's something that happens to a lot of women. They feel that they're cracking at the seams. Look inwardly and be honest with yourself. And don't forget that there's help out there for you. You need not suffer alone in silence, because we have responses, we have plans that are trying to expand mental health. But the most important thing is that you have access to services, and that you're not alone. So I think the thing I want us to look at, even as I wind up, tips just to help you get by. As you think about and consider seeking professional help, top tips that you can implement in your life. Look at self-inflicted pressures that you're experiencing or self-inflicted challenges. This juggling act that we tend to do. Look at that, be honest with yourself. And in other words, learn to determine what is real and what's an assumption. So you want to know what's actually happening at home and at work and in the family. Determine what is real and what is imagined stress. So sometimes we just pile on work that we don't need to pile on, right? Cut out the noise. If you're not getting support that you need or positive vibes that you think are important, declutter. The way we declutter our wardrobes, declutter social media accounts, declutter friends, whatever it is that you feel is contributing as noise. Declutter. Manage your expectations. Be real. You might be expecting things, huku, but you need to come down to the real levels. Talk about your feelings, be active, maintain a balanced diet. Consider developing a self-care plan. Because at the end of the day, you want things that will increase your self-esteem and self-confidence, and be in touch with your emotions. Understand what your emotions do to your body, because at the end of the day, in between there is what is where you'll find happiness, is where you'll find peace, and it's where you'll find the ability to live another day and work another day. So consider developing a self-care plan that is comprehensive, that looks at your physical health, emotional, professional, and things like that, like you can see on the slide. And at the end of the day, I think it's just important for us to say thank you to our heroes. You, our healthcare workers, are our heroes. You're the ones standing in the front line day in, day out, even before COVID. Let's be real. You save lives, you make differences in people's lives. And so it's a matter of just being able to take stock of what you've done and just appreciate yourself as well. So thank you very much. And yeah, I wish you better mental health.